As you all know, or may not know, the concentration of sperm in guys nowadays have declined, right? And I see that every day when I run my fertility clinic. People have asked why is that so. As a matter of fact, last week in the New England Journal of Medicine, they found out that the quality and quantity of spermatozoa in men in America has declined. And this study done about 7 years ago, we took a sample of 26,000 partners with totally infertile women undergoing assisted reproduction, and found that the semen concentration was about 2% per year decline, and significantly decreased, especially in the morphology. So the shape of the sperm has somehow declined. And there's constant decline in sperm concentration in infertile males in the urban areas. And this is a study done to look at 18 years of experience, and found that in Viennese men, it has declined from 27 million to 4.6 million. And we find this also here in Asian region in Malaysia. Is there any effective treatment available? Many studies have shown that we have tried everything. We have tried given androgens, we have tried given clomid, and other enhancing drugs to increase the sperm, but unfortunately has failed to show any significant increase. Even surgery for embolization. I will talk more about this on my second talk tomorrow on how to deal with men with azoospermia. So anyway, they found out that there are many studies to show that certain ingredients or nutrients are helpful in increasing the sperm concentration. And these nutrients are not the everyday one that you find in your vitamin pills. Things like carnitine, arginine, selenium, glutathione, and coenzyme 10. So they found out that if we give certain nutrients, especially selenium, or in this product called Profotil, which has a combination of all this vitamin E, folic acid, selenium, glutathione, and coenzyme 10, there was significant increase in the density as well as the improvement in the morphology. And there were 21 pregnancies within 6 months, meaning an increase of 17.5%, as opposed to those on the control group. So sperm concentration increased by 80%, and morphology increased by 30%, and motility increased by more than 100%. And men are able to father a child nowadays later in life, because not only women tend to get married later in life, men also. The question is, if women productivity ability decrease after a certain age, does this happen in men as well? The bad news is yes, it does, but not at the age of 35 lah, much older. Whether it's age of, we will see the graph later, but it's much older than usually about more than 60. It depends also. Male fertility also depends on the quality and quantity of sperm, of course, you know, the testosterone production, and it decreases by age. The temperature, the lower grade temperature, which is present at the testis, that's why the scrotum is outside the body, and the function of the testis is, the sperm is usually about 72 days. Abnormality of the sperm increases with age. So as this, when it comes to women also, when it comes to increase in age, there's decrease in ability to reproduce. And this study to show that the volume, concentration, count, motility tend to decrease after you reach the age of 60. Okay. But that doesn't mean that if you are 30 now, you're okay, because there are certain patients who do have low grade sperm. And from this study to show that the concentration decreased, like I said, and also the motility also decreases with age. So the chance to conceive a child decreases with age in both women and men. When it comes to idiopathic subfertility, is it disease or deficiency? You have this patient, this male patient is healthy. You don't find any medical problem with him, but his sperm is still low. It is said that probably lack of nutrients is the cause of decrease in the sperm quality, because male factor subfertility caused by nutritional deficiency in principle and enables to curative and preventive action by supplements. The study in 2000 found that if you were to give micronutrients to these men, it would increase their sperm quality. They found out that certain foods do increase, certain foods do have certain effects on the quality of the sperm. Broccoli. So lack of the micronutrients is probably the cause of decrease in sperm quality. That's what we call hidden hunger. Dia tak lapar, tapi dia kekurangan setengah-setengah nutrien yang boleh menyebabkan the sperm to decrease. So there was a trial done by this company with this product Profotil. Actually, there are many trials, and there are trials done in Europe, most of it in Europe lah. But this is the largest one, about 271. A combination of 8 micronutrients, whether it is superior or not in improvement of sperm motility. And they found out that one of the trials found out that by adding micronutrients, it improves the sperm density, ejaculatory volume, motility, as well as morphology. And these are taken among 132 men in the treatment group and 73 in the control group between the age of 18 to 43 and 18 to 52. But you may argue the control group, a lot of older men. But on the average is the same. So they were given 2 capsules of Profotil per day, but the control group do not have that, but only change in the lifestyle. They found that sperm density increases and motility as well increase. And there were increase in the pregnancy in the treatment group by 25%. However, there was also increase in the pregnancy in the control group by 15%, but then this was not statistically significant. What about those with subclinical varicocele? We know that you need a lower temperature to produce sperm. If you have varicocele, it increases the temperature of the scrotum and increases temperature of the testis. So it causes decrease in sperm formation. Now, when it comes to micronutrients added on this patient, they found out there was slight increase in density, volume, motility, and morphology, even though not much. So Profotil may help in increasing the sperm quality and quantity in patients with subclinical varicocele. Then you may argue that if it's subclinical varicocele, why not do the surgery? Yes, there's another argument there, but I think I will address this in my next talk. So when surgery is not recommended because of subclinical varicocele, Profotil may improve the quality of the sperm. What about DNA fragmentation? DNA fragmentation is where the DNA is seated at the head of the sperm. Okay, the sperm has no ability to repair itself if the DNA is damaged. And DNA sperm from DNA fragmentation inhibits the capacitation and stops proliferation of the embryo. Capacitation means the ability of the sperm to enter the egg. If the DNA is damaged, they have a difficulty to enter. And if they do enter by whatever means, like for instance you do ICSI or ICSI, they may produce low quality embryos. So does Profotil improve on the quality? There's one small study to show that it does increase in the ability of the sperm to enter the oocytes, even though this is not a very high, not a very many patients, only 60 plus patients. Okay. So it is said that Profotil may improve on the HPA binding. HPA binding is where the head of the sperm could bind on the oocytes. If you have poor quality sperm due to the fragmentation of DNA, you can't bind on the head of the oocytes. So how to test this in vitro? We do this test called HPA binding ability. If you're able to bind, then it is said that you can also, the sperm can also enter. There is capacitation, and the sperm can enter into the egg. So they found that by giving Profotil, it increases slightly the ability to bind. So they extrapolate that they could be also increase in ability of the sperm to enter the egg. Now they compare between Profotil, which has all the other subnutrients, compared to supplements who only have one type of nutrient, which is like carnitine. Again, about 130 patients, average of 35 years old. One given 2 capsules of Profotil, the other 1,000 only on carnitine. Profotil has carnitine also inside it, and found out that Profotil improve, especially the motility. So carnitine does have a positive effect on the sperm, but with adding 8 other or 7 other micronutrients, especially selenium, it increases the quality of the sperm. So overall conclusion, Profotil with 8 micronutrients may improve the quality of your patient's sperm, especially in the motility and morphology of the sperm. In patient with subclinical varicocele, as well as in patient with low sperm count. My own experience, I've tried Profotil for many years, and it has some improvement in the when you do a sperm analysis test again, there was some improvement. By the end of the day, our aim is to get patient pregnant, isn't it? So you could try this product, Profotil, if you find that your patient's, the male patient's sperm is of low quality. But then again, if it is very low, it's one of my personal experience, that means severe oligozoospermia or even azoospermia, no micronutrients will improve. The other thing about micronutrients is that your patient have to change their lifestyle. It is not a magic drug in the sense that you give that terus your punya sperm improve the next day, tidak. You have to advise your patient to stop smoking, and don't smoke. And stay away from people who smoke, both male and female, because secondary hand smoke has shown that it's detrimental to the quality of the embryos, the oocytes, as well as the sperm. And stop mingling around with people who smoke, because tertiary smoking, tertiary smoking, that means abang you smoke outside, you don't smoke in the house, but abang still smoke, come back, baju dia bau pokok, mulut dia bau nikotin, dia baring bedsheet dia semua bau nikotin. That is also detrimental to your oocytes and his sperm quality. So people patient from experience, patient ask, tak boleh ke doktor bagi saya satu ubat yang boleh improve saya punya sperm? My answer usually, you smoking kan? Berhenti smoking. Tak, saya nak juga ubat yang improve Ustaz. Ubat dia senang, stop smoking. Alah, doktor ni tak leceh lah. They still want that drug. If you want, you probably can give her, but they will probably spend 900 ringgit maybe for 3 months for this kind of medication. If they were to stop smoking, they will save that money on buying cigarettes, isn't it? So there's a video that I need to show.
Children are our hope and represent our future. They are a symbol of love. Our desire to have children is one born of our future. The love we have for them is boundless. The hopes we store in them are endless. But what happens when that love, hope, and desire is not fulfilled? Around the world, it is estimated that 1 in 6 couples face difficulties getting pregnant. In 1/3 of these couples, the difficulty in having children is attributed to men. A further 1/3 is attributed to both the men and women. Male infertility is a disease with many causes. Even the things we do in our everyday life can affect our chances of becoming a father. The majority of cases of male infertility are treatable. The simplest of things, such as the food we eat, can help increase our chances of becoming a father. Key nutrients can help increase and improve your reproductive health. Profortil is the first clinically researched formulation. It is uniquely formulated with 8 essential micronutrients known to have beneficial effects on male fertility. Studies have shown that men on Profortil have increased sperm density and sperm count. In addition, clinical papers indicate that men on Profortil also see an improvement of all sperm parameters, some even surpassing WHO reference standards. So, what are you waiting for?